Hello everyone. So in this video, I am going to explain all the pharmacological drugs which were used in the treatment of the rheumatoid arthritis. So as we all know, rheumatoid arthritis is an autoimmune disease. So it is an autoimmune disease which affect many systems, and in wherever the suffix is itis is used, it means that there is inflammation. So here in rheumatoid arthritis, inflammation and pain is there. So for inflammation and pain, as we all studied that for inflammation and pain we use the drug that is NSAIDs and steroids. But here if the disease is progressive, then these two drugs were ineffective, means they does not treat the progressive rheumatoid arthritis. So not effective in progressive rheumatoid arthritis. So for the progressive rheumatoid arthritis treatment, we have to use the DMARDs. And what is the full form of the DMARDs? DMARDs were the disease modified anti-rheumatoid drugs. So DMARDs were used for the progressive rheumatoid arthritis. So what will they do? They slow down the disease progression, and they were the slow acting. So they were slow acting drugs. DMARDs were the slow acting drugs. So to make the effect, we have to use them. We have to take them for a month to produce its effects. So we have to take them for a month to produce effects. So till now I told you that it is a slow acting drug, so we have to take it for a month for treatment of progressive rheumatoid arthritis. So how the DMARDs is classified? So DMARDs is classified into two types, that is the conventional form and the other one is the biological form. So in the conventional form and the biological forms. So for the conventional form and biological forms, in biological forms means these biological DMARDs were formed by the recombinant DNA technology. So they were formed by recombinant DNA technology. So for in a few minutes, we will talk about the biological DMARDs. Now I am going to tell you about the conventional DMARDs. So in the conventional DMARDs, how we can remember which drugs were conventional DMARDs? We have the mnemonic, that is cute and pugly Malika Sherawat. So this is the mnemonic for the conventional DMARDs, that is cute and pugly Malika Sherawat. So in the cute, C stands for chloroquine, which is a drug of choice in pregnancy. So it is a drug of choice in pregnant female. And P stands for the penicillamine, which is a chelating agent. So penicillamine, and it is also used for copper poisoning and in the Wilson's disease. So it is also used in copper poisoning and Wilson disease. A stands for the azathioprine. G stands for the gold salts. L stands for leflunomide, which basically inhibit the dihydroorotate dehydrogenase. And I stands for JAK inhibitors. Or we can say inhibitors of JAK. So I stands for JAK inhibitor. Malika, M stands for methotrexate, which is the most commonly used drug in the DMARDs. So in the rheumatoid arthritis, so it is most commonly used drug. And S stands for sulfasalazine. As we all know, sulfasalazine is also used in the treatment of ulcerative colitis. So here I am writing that it is also used in ulcerative colitis. So these were the drugs for the conventional DMARDs, that is cute and pugly Malika Sherawat. C for chloroquine, penicillamine, azathioprine, gold salts, leflunomide inhibitor, that is JAK inhibitors, methotrexate, and sulfasalazine. So sulfasalazine is it is also used as a sulfasalazine is also act as a disease modifying agent, that is in alkaloizing spondylitis. So it is also used in alkaloizing spondylitis, and also used in ulcerative colitis. Methotrexate, it is the most common used drugs. JAK inhibitors, for the JAK inhibitors we have two drugs, and those drugs were like the tofacitinib and baricitinib. And these were the oral drugs. We can take in the oral form JAK inhibitors in the rheumatoid arthritis. So oral drugs. And what were the name of these two drugs? So these two drugs were the tofacitinib tofacitinib, and the other one is the baricitinib. So here the suffix which is used is citinib, tofacitinib and baricitinib. Basically, these two drugs increase the risk of infection. Please remember, these two drugs increase the risk of infection. And these were the oral drugs. We can take oral in the oral form in the treatment of rheumatoid arthritis. These were the two drugs for the JAK inhibitors, where the suffix is the citinib. Suffix is citinib, tofacitinib, baricitinib. And for the leflunomide, I already told you that in the leflunomide, it inhibits the formation of pyrimidine dihydroorotate dehydrogenase. So it inhibits formation of pyrimidine dihydroorotate dehydrogenase. And G stands for gold source, and azathioprine penicillinamine, which is also used for the copper poisoning and Wilson disease, and C for chloroquine, which is the drug of choice in the pregnant female. So this all were the conventional DMARDs. Now I am let's talk a few points about the methotrexate drug. So for the methotrexate drug, it is also used in the, and it is also used as an anti-cancer drug, like in the quantity of 5 milligram daily we have to take in the cancer form. While for the methotrexate, for the rheumatoid arthritis, we have to use it in 5.5 milligram per weekly. So these were the doses which were used in the rheumatoid arthritis, while for in the anti-cancer form it is used as 5 milligram daily. Now rheumatoid arthritis, it increases the adenosine extracellular receptor, that is an anti-inflammatory. So, and also methotrexate inhibit the dihydrofolate reductase inhibitor. So methotrexate, it inhibit dihydrofolate reductase inhibitor. So it, as it inhibit the dihydrofolate reductase inhibitor, so it inhibit the activation of folic acid. So it inhibit activation of folic acid, that will result in the decreased formation of purine and pyrimidine. So now, what were the side effects of methotrexate? So for the side effect of methotrexate, M stands for megaloblastic anemia. So here is the side effect, that is M is for megaloblastic anemia. It can lead to megaloblastic anemia. And the other one is it causes the liver toxicity. So it is hepatotoxicity. It can lead to hepatotoxicity. That's why it is contraindicated in those patients who have like liver problem. So for giving methotrexate, we have to check the liver function test. So for methotrexate, we have to check liver function test. After that only we can give methotrexate, because it can lead to hepatotoxicity. Now the next one, that is the biological form DMARDs. So for the DMARDs, the other category, which is the biological forms. So in the biological form DMARDs, we have like TNF alpha inhibitors. First one is the TNF alpha inhibitors. Second one is like interleukin 6 inhibitor or interleukin 1 inhibitors. Fourth one is the like co-stimulatory inhibitors, co-stimulation inhibitor. So for the TNF alpha inhibitors, TNF alpha blockers, we have the mnemonic. So for the TNF alpha blocker, we have mnemonic, that is ACE inhibitor को गोली मारो, that is ACE inhibitor को गोली मारो. This is the mnemonic for the TNF alpha blockers. So here A stands for adalimumab. Here the all have endings mumab. C stands for sertolizumab. E stands for etanercept inhibitor. I stands for infliximab. And goli stands for golimumab. So all have the endings mumab or mab. So this is the mnemonic for the TNF alpha blocker, that is in AC inhibitor ko goli maro. And in this, all are given as subcutaneous forms. Except the infliximab. Here, just remember, I stands for intravenous. So infliximab is given as IV route. And TNF alpha blockers, these were used for the used in like Crohn's disease. It is used in Crohn's disease, and also it is used in psoriasis. So in these conditions also we can use that TNF alpha inhibitor, that is Crohn's disease and the psoriasis. Now the interleukin 1 inhibitor. So for the interleukin 1 inhibitor, we have a drug that is the anakinra. That is the anakinra. How we can remember for the interleukin 1 inhibitor? We can remember that kinra, like interleukin. Kin stands for interleukin. So here kin stands for interleukin, and A, as it is the first letter of alphabet. So here the 1. So interleukin 1, R for receptor, R stands for receptor, and A stands for antagonist. So it is interleukin 1 receptor antagonist, anakinra. In this way we can remember it, and it leads to the joint, and in this joint destruction is not occurring. So there is no joint destruction, Now the next one, that is the interleukin 6 inhibitor. So for the interleukin 6 inhibitor also we have the drug that is interleukin 6 inhibitor, or in other words we can say interleukin 6 receptor antagonist. So in this we have the drugs that is tocilizumab, and the other one is the sarilumab. So here the MAB stands for monoclonal antibodies. MAB stands for monoclonal antibodies. So MAB is for monoclonal antibodies. IL stands for interleukin, and S stands for 6. As in the 6, S stands for 6. So it is the interleukin 6 monoclonal antibody, that is a sarilumab, and it is used in rheumatoid arthritis. While for the tocilizumab, so tocilizumab is a treatment of cytokine release syndrome. So tocilizumab is a treatment of cytokine release syndrome. Now the last one, that is the co-stimulatory inhibitor. So in this we have only one drug, that is abatacept. So this is the co-stimulatory inhibitors, and these were the demands, those were the biological demands: TNF alpha inhibitor, interleukin 6, interleukin 1, and co-stimulatory inhibitor. Interleukin 1 anakinra. Kin stands for interleukin, A stands for 1 receptor antagonist. For interleukin 6 receptor antagonist we have tocilizumab, sarilumab. For co-stimulatory inhibitor we have abatacept, and for the TNF alpha blockers we have the ACE inhibitor ko goli maro. A stands for adalimumab, certolizumab, etanercept, infliximab, and golimumab. All were given by subcutaneous route except the infliximab, which is given by intravenous route, and we can remember it, I stands for intravenous route. So that's all about the drugs of the rheumatoid arthritis. I hope this video is very useful to you. Thank you. Bye bye.